Don't get in the water either, though. So speaking of pets, it's now time for Ask the Expert. Our resident pet vet, Dr. Katie Heinrich, here today.
She is joined by 3-year-old Chowy, a Shih Tzu and Bichon Frise mix. Chowy has a congenital eye defect, more commonly known as cherry eye, in both of her eyes, right?
That's right.
Because you said something, and Steve and I said, what? All dogs have a third eyelid.
They do. So in the inner corner of their eye, there is literally a little membrane there that we call the third eyelid. And in most dogs, it doesn't cause them a problem, and you might kind of see it. It basically can act as a wiper to refresh the tear film over the eyes, and you'll see it go up when they're sleeping and things like that. But there's a gland in that third eyelid that produces 30 to 50% of the tear production in the eye. And in some dogs, that gland, the connective tissue that keeps that gland in place to the bone in the face will break down, and that gland will pop out, and we call that cherry eye.
So she has dry eyes.
That is a possible complication when their third eyelid, when that gland pops out like that, because it basically cuts off the production for that part of the tear supply. So what we recommend typically is a surgery that helps tack that third eyelid down so they still have normal tear production.
Didn't work here, did it?
Didn't work here. It does have a high failure rate. There's different surgical techniques that can be used, and some work better than others.
So the cost too was, I mean, it's steep, $400.
Sure, yeah. And you can even get it done with an ophthalmologist, a specialist, and it can be even more pricey that way. But
okay, so that didn't work. What are the options then? I'm assuming this is going to get worse as she gets older.
Yeah, basically within 3 to 6 years, probably about 60% of dogs will develop dry eye, where they're not getting enough tear production in their eye. And if that's not treated over time, they will get pigment changes that cover their cornea. It's their eyes, basically the eye is trying to protect itself, but that pigment basically obstructs their vision, and they can get some pretty horrible eye infections and things like that.
So drops, things like that?
Basically surgery again is really all you can do. There are some drops that can help lubricate the eye, but you're basically just you're not fixing the problem. You're just fixing the symptom.
Chowy, thank you much. Got a question for the experts? Email them, asktheexpert@todaystmj4.com.